task force that looked into the mental health effects of COVID-19 will be expanded as the authorities look beyond the pandemic. The new Interagency Taskforce on Mental Health and Well-being will develop a national strategy in this area, pulling together various agencies' work. Cheryl Goh with more.
Mental health issues have come to the fore against the backdrop of the pandemic. An Institute of Mental Health study found that more than 1 in 10 people surveyed suffered from pandemic-linked depression or anxiety in the past year. A National Youth Council poll last year also found that more than half of the youth surveyed see mental well-being as a challenge. They were mostly concerned about the future, finances, as well as work and studies. But with Singapore entering a new normal, authorities are looking to the future of mental health. The new Interagency Taskforce will oversee a national strategy, aligning and tracking the efforts of various agencies.
We've started work already, and we've recently met to discuss several areas of focus in the coming months, especially how to build the mental resilience of our population. We look forward to engaging Singaporeans in this national important effort to enhance all of our health mentally and our well-being.
The Interagency Task Force will also standardise training for mental health professionals and consolidate online resources on a national portal. The group will bring together the expertise of 21 people from the public, private and people sectors. The Singapore Association for Mental Health wants to help those with mental health conditions go back to work.
To instill confidence in the person with a mental health condition, you have to equip the person with some skills that is needed for the job. And then on the other side, we have to prepare the employer so that they can be understanding. There's a long road ahead to get this thing done, so that more people could readily, apply for a job and then get the job and perform well in the job, just like anybody else.
CEO of Touch Community Services, James Tan, who is also on the task force, says his organisation saw nearly 60% more calls from youth about mental health-related issues last year. He says the task force will have to assess the complexities of needs on the ground and work with different stakeholders to address the issues.